I'm Katrina Cotton for Invest in Pitch Media. Thanks for joining us today. Relic Health Technologies, a rapidly growing global healthcare technology company developing innovative virtual care solutions for the multi-billion-dollar healthcare market, has signed a significant new contract with a leading U.S. healthcare company. Rated among the top facilities in the United States, this new client, with 75 locations in 8 states, provides integrated services across a wide range of care facilities, including skilled nursing, rehabilitation, dialysis, long-term care, memory care, and home health. Starting with Kentucky, a state with very high rates of hypertension and diabetes, particularly among seniors, the company expects to add more than 25,000 new patients to its iUGO Care platform during the first 12 months, with implementation plans for the remaining facilities in the other 7 states to be finalized with the client in the new year. Relic will be providing remote patient monitoring, remote therapeutic monitoring, chronic care management, behavioral health integration, and transitional care management to patients both in facility and in the community. Onboarding will begin in the next quarter, which will generate revenues of $65 per patient per month at an approximate gross margin of 70%. We were fortunate to catch up with Dr. Lisa Crosley, the busy CEO of Relic Health, who has joined us today to discuss this new contract and the company's recent success at landing other significant contracts. Welcome, Lisa.
Thank you, Katrina. Thanks very much for having me. I'm very excited to discuss this contract. This is a very prestigious client for the company. Their facilities have been ranked amongst the top in the United States in both Newsweek and U.S. News and World Reports, and reports on long-term care facilities and skilled nursing facilities. And those reports are used by family members and caregivers to determine where their loved ones are going to be admitted for short-term skilled nursing or for long-term care and assisted living. So those are very impactful reports, and it's a clear indication of the quality of this particular client. They are in 8 states and have 75 different locations, and they provide care both on an inpatient basis and out in the community. And this is really kind of a follow-on to some of our other large accounts that we've signed successfully, which include the health plan that operates ACOs and sees roughly 1 million patients a year. And we also signed a U.S. healthcare plan that's in multiple states that has 1,200 care centers and a large U.S. skilled nursing facility network, and we have over 180 of their facilities. So we really have proven over the last kind of 6 to 9 months that we are able to attract these much larger networks that have very large patient numbers. And I think it's a real testament to our value proposition and our uniqueness in the market. So many of these clients have actually come to us as opposed to us having to go to them and do kind of a hard sell. And that's really based on the results that we've had in our historical deployments, where we're able to reduce hospitalizations and hospital readmissions by well over 80%, which translates to very significant savings in healthcare spending, and therefore helps these clients avoid some of the really significant financial penalties that Medicare and Medicaid assess if you have an unusually high number of readmissions. And I think it's also, real testament to us that we are able to attract these blue chip clients. And the wonderful thing about healthcare is it's very difficult to break into. But once you are established and you are seen as the gold standard in your space, you do get a lot of business through referrals. So it really does demonstrate how much our clients are happy with our solution and how unique what we offer in the marketplace is, that we're getting so many of these very significant, very large clients who really are some of the top healthcare organizations in the United States, mostly through our referrals and word of mouth. And with this contract in particular, we've mentioned in our press release that it's going to be a staged rollout, as all of our deployments are. So our initial sort of phase 1 deployment in Kentucky will get us about 25,000 patients over the first 12 months. But beyond that, we're expanding into the 7 additional states, and we'll have the details around the timing for that in early 2024. But obviously, this contract is much more significant than just 25,000 patients. It represents hundreds of thousands of patients. And because we are dealing with a a population that tends to have some turnover. So a lot of these patients are in, say, skilled nursing temporarily and then discharged home. And will be a lot of new patients for us every year. So this is kind of almost like an evergreen fund for us. So we're very excited about the contract and about our traction in the market in the US in general. And we're looking forward to a very exciting rest of 2023 and beyond. Thank you very much for having me, Katrina.
Thank you, Lisa. Based in Hamilton, Ontario, with offices in Florida and Texas, Reliq specializes in developing innovative virtual care solutions for the multi-billion-dollar healthcare market. The company's powerful iUGO Care platform for care coordination and home healthcare integrates wearables, sensors, voice technology with intuitive mobile apps and desktop software for patients, families, clinicians, and healthcare administrators, allowing complex patients to receive high-quality care at home, improving health outcomes, enhancing the quality of life for patients and families, and reducing the cost of care delivery. iUGO Care provides real-time access to remote patient monitoring data, allowing for timely interventions by the care team to prevent costly hospital readmissions and emergency room visits. The shares are currently trading at 44.5 cents. For more information, please visit the company's website, reliqhealth.com, or by email at ir@reliqhealth.com. Investor relations in the United States is handled by Ben Shamshian of Lytham Partners, who can be reached at 649-829-9701 or by email at shamshian@lythampartners.com. I'm Katrina Cotton for Invest in Pitch Media.